monitor.
Hello, I'm on the meeting, B.
There seems to be less people right now than last week. So
I know.
Oh, but they're coming, John.
Yeah.
Trust me, they're coming.
And
We typically have
I've been
19
meaning to
right
put
at.
these on next door. Next time we'll publicize these meetings on the next door and El Sobrante. We could do that and get more. So I think we had 40 on last week. Did we?
Not quite that high, but
I put a message on Nextdoor a couple hours ago.
Oh, good.
And
We
so
have the
Hila's
ability to-
definitely got her people coming. So we've definitely got lots of people now on the list and interested, and that's all great and good.
Good.
There
Yeah.
will be people coming because of presentation about concerns about fire safety.
Yep.
And those people are not on the call yet, but they
Hear
were.
that,
there
hear
was an
that, Louis?
email.
Louis, you're the central attraction.
Yes, you are, Mr. Brochard. You are.
Oh, man. No pressure here, huh?
Louis, are
Get
you
out
at the office? Doesn't look like you're at home.
I'm still at the office, yes.
Yeah.
Get out your flame retardant gear and don it, because you're going to be.
he'll be all right.
I'm
Louis
kidding.
can handle it.
This is not his first rodeo.
Louis can handle it.
He
He
is-
can handle it all.
He and Chief
And
Thomas
remember,
have been around a long time. They'll be all right.
Just so everyone knows, remember, this is being recorded. So all your comments are being recorded. Just
Oh, darn.
closure. And I know
And-
our health officer is here. Yeah. So that's,
Dr. Farnatano,
Yeah.
thank you.
we'll have,
And-
right. Sorry.
Oh, sorry. I was just another little housekeeping thing just before we start. Tom, you might remind people that when they're not speaking to please turn their mics off. I can sometimes turn people off, but not always, and that's how we get so much crosstalk. And most people should just stay mic off most of the time unless they're going to speak.
Okay. Good idea.
Mr. Lang, you could start the meeting if you wanted to, because you do have a quorum of the MAC. There are 5 of us on the call.
Mr. Lang.
Mr. Lang, okay. Can everybody hear me?
Yes, sir.
All right, so I agree it's probably a good time to start the meeting. I suspect folks will start showing up in a few minutes, but this is the November meeting of the El Sobrante Municipal Advisory Council. This is an advisory board, an advisory body to the Board of Supervisors of Contra Costa County. And I'd like to just welcome everybody. It's going to be a busy meeting, and we'll have very important presentations, not only from our sheriff's office, but we'll have a presentation on wildfire safety from Chief Brochard, and a presentation, an update on the COVID-19 pandemic and Contra Costa County from Dr. Farnatano. So I would just like to make sure that people do 2 things. First, when they ask questions regarding these presentations, that they try and keep questions and comments to 2 minutes. And then also, if you are not talking, please mute your microphone. That helps tremendously with limiting background noise and things like that. So with this brief announcement, I'd like to move that we approve the minutes from the October 14th, 2020 meeting.
So I didn't send the minutes out. We just wrapped it
Oh,
up.
okay.
We'll do that in December.
So we'll table that to next month. So
Tom, can you take the roll?
yes, so let's start with our roll call. So Tom Owens.
Here.
Okay. Jim Herman. James, is that an excused absence?
I was not contacted.
Okay. Melinda McLean.
Here.
Sarah Pochillo. Okay. Mickey Norris.
Present.
George Cleveland.
Hello there. I'm here.
Okay, and Shirley Rosenthal Winston. Okay, so we do have a quorum, correct?
Right.
All right, so we'll move to approve the minutes from we'll approve the minutes from last month's meeting next month. So James, treasurer's report?
$3,000.
$3,000, okay. So we'll start off with a presentation, a county update by Supervisor Joya.
Sure, and I will be brief because I do want to combine it with Dr. Farnatano so we can take questions after his presentation. Because clearly one of the major changes, which you'll hear about from Dr. Farnatano, is our the move from Contra Costa into purple, the most restrictive category by the state, which has resulted in closing down more activities. And let me just say in layperson's terms, I think we're in the thick of things, and this is the time for all of us to really be vigilant and to be very serious and to follow the health advice you're going to hear. While we may be a few months away from a vaccine, getting through this winter will be the most challenging time. And I will say this: the county still has its 250 medical beds on standby at the Craneway building, at the Ford building in Richmond, that it will ramp up if it is needed for hospital capacity. There's been a tripling of the number of COVID patients in Contra Costa hospitals over the last month. And that doesn't include the increase in patients in Alameda County hospitals. Those of us who live in West County are more likely going to be at a hospital, for example, Kaiser Oakland. So you will hear more about that. I will just say the single most important thing cutting through a lot is to wear your mask. That has a major impact in slowing the virus. If everyone wore a mask, we would save tens of thousands of lives. So that's my brief report. Dr. Farnatano will go more into it. The county has been, actually we're in the midst of hiring a new county administrator, which we will finalize in early December with the new administrator coming on board. We are scheduling an update to the East Richmond MAC coming up about update on the general plan. So I think that would be a good item to put on your next meeting agenda. Could be December or January, an update from the planning department as we continue to proceed the process on updating the county's general plan. And as you know, there were meetings in El Sobrante to hear community principles that can get incorporated. So I think getting an update of where that is would make some sense. Supervisor Glover and I have been working for several months and created a proposal to create an office of racial equity and social justice at the county to link together the efforts that the county is currently doing, but to strengthen them and make them stronger across all departments. And in that process, we actually raised money from local foundations to conduct a 5-6 month community listening process, a community planning process for the office to really engage with the community organizations and members countywide who've been working on these issues. And you'll hear more of that as we kick that off soon, probably in December. There's going to be a community Zoom meeting to kick off that community planning process to create this office. So there is community voice. There was one other item I was going to mention, but it slipped my mind. So with that, I'm going to introduce. Oh yeah, what I was going to say, since I'm turning it over to the health department. Health department has actually hired an equity officer that will continue to work on equity issues in the health department specifically. And that's, again, having an office in the county administrator's office is not to replace those efforts, it's to build on it. And I want to make clear that the office is going to address equity in many areas, while the initial focus right now before us is racial equity, but it will address issues of equity dealing with ethnicity, immigration status, gender, sexual orientation, economic disability. So it's broader, language access. So it's really to look at equity issues across the board. With that, let me turn it over to Dr. Chris Farnatano, who is our county health officer, who works with other Bay Area health officers as well as with the state. And you've heard the recent change to purple, and he will explain what is going on. Dr. Farnatano?
Thank you, Supervisor. Thank you, Supervisor Glover. Sorry.
Oh, Federal and I work together a lot. That's good.
I know you do.
We're the G's, right? West County.
So thank you. Yes. So we've been through 2 waves of COVID in our county. The first wave, we instituted a very strict shelter-in-place order, and that wave was small, and it gave us time to learn about the virus, ramp up our testing, and prepare our hospitals, and learn more about how this disease spreads. We slowly started opening up things in June, and the virus quickly took off again. And so we had a big surge in the summer, and we had to institute a lot more stringent requirements, a little more targeted this time. The state issued a statewide mask order at that time, and through the efforts of the community in wearing their masks and staying away from others, we got through that summer surge, and we didn't overwhelm our hospitals, although the hospitals were feeling pretty stressed and starting to worry about their staffing at the peak. The state then came up with this 4-tiered blueprint on a different way to slowly and gradually open. We were hopeful that by expanding testing and contact tracing and having guidelines for businesses, then slowly opening up very cautiously, that would be sufficient to keep this virus under control. Unfortunately, about 2 weeks after, we moved from the purple tier into the red tier, and then we barely kind of slid into orange tier criteria. The cases started going up again, and their rise has been accelerating. So our cases have been going up. Our test positivity, what percentage of the tests that we're doing are, even though we're doing more testing than ever, is going up. And most concerning is our hospital numbers are going up. At one point a month ago, we were down to 17 patients in the hospital due to COVID. Now we're at 67. Our peak in the summer was 105. So we're rapidly approaching that number, and we could surpass that within the next couple of weeks. So we're learning more and more about this virus, but indoor activities, whether they're in a business like a restaurant or whether they're in a home like a social gathering, are really driving the spread of this virus. And as the weather turns colder, we're really concerned because people are being driven indoors because of the weather. And then we've got these holidays approaching, and we've seen after every single holiday a surge in COVID because of people gathering, whether it was Memorial Day, Father's Day, 4th of July. Now we're seeing it, after Halloween. Although this surge started even before Halloween. So it's really worrisome that we're learning more about this virus. Like many other coronaviruses, seems to thrive in cold weather. That may partly because it survives longer in cooler temperatures and moisture temperatures, and partially because people are gathered indoors in colder temperatures. but we were hopeful we might be able to avoid this terrible surge that's going across the country. But we clearly are, even though our surge here has been delayed, we haven't been able to avoid it. And so that's why multiple health officers from across the Bay Area region last week instituted stricter procedures, not waiting for the state. And so we closed indoor dining and other especially high-risk activities. And then the state followed this Monday by applying what they call the emergency brake and moving most of the state, where 93% of California residents live, in those counties, into the purple. So looking at West County has been very hard hit throughout this pandemic. San Pablo's been the hardest hit community all along, but all the communities in West County have been harder hit. So in El Sobrante, just in the last 14 days, there's been 30 cases of COVID. In Pinole, there's been 46. In San Pablo, there's been 157. And in Richmond, there's been 263, all in the last 14 days. Those rates, when adjusted by the population, for El Sobrante, Pinole, and Richmond, each of those areas have a rate in the last 2 weeks that's 2/3 higher than the county rate as a whole. For San Pablo, their rate's over 3 times higher than the county as a whole. We know the folks who are at risk are essential workers. We know people of color are hit harder by this virus in their communities, in large part because of a higher percentage of essential workers, folks that have to go out, have to go to work. Also, more crowded housing and more people living more densely together also poses a risk. So all those things combine to put certain communities at higher risk of this virus. So that's pretty bleak. The encouraging thing is we really are seeing some encouraging news about vaccines. We were hoping for a vaccine that might be 50% effective, and we've gotten early reports about 2 different vaccines that are about 95% effective. And both of them also seem to help prevent severe disease as well. So not only do you not get COVID, but if you get COVID, you're not as likely to get very sick. So that's really important. But it's going to take a while to get those vaccines into the community. So it's, in a few weeks, these companies may be submitting their data to the FDA. The FDA will likely, if the data is as promising as the early reports, grant an emergency use authorization, and then they'll start rolling out available vaccine. But the companies haven't produced nearly as much vaccine as is needed to vaccinate a large swath of the population, and they're unlikely to produce enough until the spring or maybe even into the early summer. So our health department has a whole vaccine branch that's been working for months to prepare for this. The state and the feds have developed criteria how to prioritize the vaccine. The first group will be healthcare workers who work with COVID patients in hospitals and nursing homes to protect them and to protect the patients they care for. And then it will go to other high-risk individuals like senior citizens over 65 and those with chronic medical conditions. And then it'll gradually then spread out to the general population. But it's going to be a very complicated, months-long process to get all the vaccine into the arms of the people who want the vaccine. But so in the meantime, we've got a winter surge to survive through, to get through. Already 250,000 Americans have died of this vaccine. That's more more deaths from COVID than from all the Americans that died in World War II. And World War II lasted 4 years. And we've only been living with this virus in this country for about 9 months. So we have a surge that could potentially be worse than the surges we've seen in California so far. Certainly in the rest of the country, it's the worst surge most of the rest of the country has seen. Only time will tell if all the steps we've taken to move to purple tier restrictions will be enough to blunt this surge and make it not as severe. But with the upcoming holidays, we're really concerned about people gathering. So our key message is wear your mask, stay away from people outside of your household, try not to gather, don't gather. If you have to have a gathering, make it small, make it short, make it outside, and keep your masks on when you gather. If you take your masks off to eat or drink, stay at least 6 feet apart from anyone else outside of your home. All those things are really vital if we're to get through this this surge we're facing. So I'll stop there and open it up for any questions.
Hey, this is Tom. Thank you very much for the presentation, and much appreciation for the work that you and the other public health officers in the Bay Area are doing. And so we appreciate your work greatly. I have a couple of questions. The first one, do you have any recommendations regarding potential upgrades of masking from cloth masks to 3-ply fabric masks? And second, what are you doing to prioritize PPE for essential workers, for public-facing workers, and for people who live in high-density housing? And that's it, just those two.
So, so there, not all masks are the same. The best masks are an N95 mask that actually is fitted and makes sure it actually makes a good seal. The next level is what we call a surgical mask or medical grade disposable paper mask. And then the next grade is a cloth mask, and not all cloth masks are the same. So having multiple layers, having a fine weave rather than a coarse weave, that's more important for catching those small particles. Having a mask that fits tightly against the face so that the air moves through the mask and not around the mask is also important. Right now we've got adequate PPE for our healthcare workers and our hospitals, but there's concerns with this surge going on that we want to be able to maintain that. So we have been prioritizing N95 masks and surgical masks to those medical situations. And we have a whole logistics team at the health department that works with, and we still get 50 to 100 requests a day from medical offices, nursing homes, congregate living facilities for masks and other PPE. I think my advice for the general public is, wear the best masks you can. Generally N95s, they're really being directed towards healthcare. So it's difficult usually to just walk into Walmart and buy N95s anymore. But the surgical masks are in pretty ready supply. And if someone feels they want to take that extra step, I don't think there's a shortage of surgical masks at this point where I'd be concerned about the general public wearing them. Cloth masks do have quite a lot of protection though, and generally what I do is I wear a cloth mask when I'm in the grocery store, when I'm out taking a walk in the neighborhood. I carry it with me, and then when anybody comes close, I put it on. When I'm in my clinic and I'm seeing patients and I have to get within 6 feet of them to listen to their heart and look in their ears, I actually wear an N95 mask that's been fitted, and I wear a face shield because I can't keep my distance, and I'm seeing a lot of people that I'm being exposed to. So I hope that answers your questions.
Are there any other questions from the board before we go to the general public?
George Cleveland.
That would, yes. Doctor, you mentioned in your presentation the chronic health conditions. Can you give some examples of what falls into that category as respect to the potential vaccine?
What they're looking at, and the state is still kind of refining the criteria, but what they've been talking about is clearly age as one thing, you know, over 65. And this virus, clearly the mortality so much depends on your age. But then people with chronic lung disease like severe asthma or COPD, emphysema, diabetes, and people who have impaired immune systems, either from cancer or chemotherapy or some other reason that their immune system is suppressed.
Okay, thank you.
Mickey or Melinda? Okay. Our first question from the audience, Pam Morris.
Thank you, and thank you for this presentation. I have two questions really quick. One, on the mask, there's the kind of N95 that has that ventilator valve. It's a one-way valve.
Yeah.
And then the other question is about testing, and which tests can you trust the results that you're not either getting a false negative or a false positive?
Yeah, great questions. So first of all, we don't recommend the masks that have the valve, and the state masking order says that those don't qualify as a face covering. And the reason for that is those valves are designed for when people are working around dust or other things to protect the wearer from small particles. But the whole purpose of the mask order and the mask recommendation is that my mask protects you. It keeps the virus particles that I'm breathing, the mask catches most of them, keeps few of them out and going to others. But those one-way valves don't prevent the virus particles from leaving the mask. So they may keep things from coming in, but the main purpose of the mask is to protect others. And so that's why a mask without a valve is better. Now I say my mask protects you, and your mask protects me. We have actually learned it works the other way as well a little bit. So the primary benefit is keeping my virus particles inside my mask, but it also does decrease how many virus particles I'm breathing from the surrounding air. And studies seem to show that if you get less virus, you might not get as sick if you get COVID. So wearing a mask, it might keep you from getting as sick if you do get COVID, as well as you're protecting others. But that valve defeats part of the process. Now, some people say, well, I've got a mask with a valve and it's got a little cloth cover over the valve. Well, that's a little better, but usually that cloth cover isn't as thick as the rest of the surrounding material in the mask. So it's like wearing a very thin mask. So it's still not ideal. So it's better to avoid those masks with a valve altogether. And then the different types of tests, there's really sort of three different tests. The standard test is, we call it PCR, or a genetic test. It looks at DNA of the virus, can pick up very small amounts of virus, very sensitive. It's also very, very accurate. So it's very rare to get what we call a false positive. The test says you have it when you really don't. That rate is usually around 1% or so at the most, that those tests will give a false positive. So they're very reliable. They can pick up infection very early. And that's the kind of standard test, and that's where most tests are done. Problem is, it has to be done in a formal lab, and usually it takes a day or two to get the results. There's a few more rapid tests, but they're still very complicated machines. You have to be run in a formal lab. Now, there's a newer kind of test called an antigen test. And those look at protein particles from the virus. And some of those tests can be very rapid. In fact, they can be done outside of a laboratory, get your results in 15 or 20 minutes. In fact, some of them are on like a card, doesn't even need a machine. It's almost sort of like a pregnancy test. You look for a color change. It's a little more complicated to read. You have to be a little bit of training on how to read them right, so that you're reading them correctly. But essentially, it's it's on this card. You do a swab in the nose. You swab it on the card. You add reagent. You wait 15, 20 minutes. You get the result. So that's a great benefit. You can get the result really quickly. You can do it lots of places outside of a lab. The drawback is it's not as sensitive. And so it's only really recommended for people who have symptoms. People who have symptoms usually have much higher levels of virus. So in using it in people within the first 10 days of their symptoms, it's a really good test. If people have symptoms in those first 10 days and they do the test and it's positive, it's a pretty reliable test that they can be pretty confident that person actually has COVID. But it's not recommended to be used in people without symptoms because then it's not as reliable. And we're getting more and more of those tests. We're using those now in our testing sites for people who come in with symptoms so that we can give them an answer right away instead of waiting a day or two for the result, and so they can quarantine. The third test is an antibody test. An antibody test doesn't tell you if you have infection now, it just tells you if you had infection before. And usually after an infection, it takes about 3 weeks for somebody to develop antibodies. And we're still learning more about what these antibodies mean. Does it mean I'm immune and can't get COVID again? We're not really sure. And some of these antibody tests aren't even that reliable. So some of them, if you had a positive antibody test, it's not even a guarantee that you actually really did have COVID. So those are kind of interesting, but they don't really do much to sort of change advice. If someone has a positive antibody test, we still recommend they wear a mask and social distance because we don't know whether they could still get COVID again.
Thank you. And who should get tested if we don't have symptoms and if we haven't knowingly been exposed to somebody? Who should get tested?
We're recommending anyone who's an essential worker or otherwise is out in the community a lot, get tested on a monthly basis. That includes teachers, grocery store workers, retail workers, restaurant workers, healthcare workers. I get tested every month. I got another test scheduled on Friday, and we really recommend everyone who's out and about in the community get tested. We've been recommending for the holidays coming up, we recommend don't gather, but if you are going to decide to not follow that advice and gather, get tested before you gather and then get tested afterwards. If you get tested before everyone who's gathering together gets tested, one of you tests positive, then that person could isolate themselves, not join the gathering, prevent a catastrophe of spreading COVID within that gathering. We've run about 500,000 tests in this county since we started. That sounds like a lot, but we have 1.2 million people in this county. That means, and a lot of people like myself have tested multiple times. So that means more than half of the residents of Contra Costa County have never been tested. Now, some of them may have been really strictly isolating, and that's probably okay. But there's a lot of people who should get tested who haven't been getting tested. So we really encourage people to get tested.
Where do you go to get tested?
So you go to our website, cchealth.org /coronavirus, and there's a big Get Tested button there, and you can sign up online and register for a test. There's also a phone number you can call. In fact, it's right there on my mask. It says Get Tested 1-855-5-TEST-ALL, TESTALL. So that's the I'll just put it up here on the screen. It doesn't really show up there, but so and that's we have a dozen testing sites run by the county, or plus 3 state testing sites. There's one in San Pablo, there's one in Richmond, there's one in Pinole. But also anyone who has insurance, their healthcare provider probably also offers tests. So Kaiser has lots of testing sites. Lifelong medical clinics have do testing. So there's a lot of, first check with your own provider to see if they offer tests. Otherwise, anyone is welcome to come to the county test site.
Thank you very much.
And Dr. Farnatano, we have one question in the chat from Marilyn Sarney. Some counties are not so generous. Could a visitor to our county for 2 weeks use public testing here?
So generally, we want our testing sites to be used by someone who either lives or works in the county, but we really take all comers. So we've had out of state travelers, out of country travelers, and we've gotten them tested at our sites. So we're not in a job of turning anybody away.
Okay. Are there other questions for Dr. Farnatano?
I think Viviana had a question.
Yes, I saw that. I'm sorry. I'm sorry, Viv. I even said yes. I'm sorry. Please unmute yourself.
Yes. Good evening, Dr. Farnatano. My question is about air conditionings or air circulating systems inside restaurants. So up to now, for a few weeks, you were able to have dinner inside restaurants. And I noticed that people were really spaced. There were lots of space between tables, and sometimes people were sitting in booths. So you were not in contact with other people. But then I later read that COVID can be spread by the air, not necessarily air conditioning, but the air circulating on the restaurants. So where even if you're not directly in contact with somebody, but you're eating without the mask, somebody from another table far away is infected, and that air is going around and maybe coming down, from the air conditioning where you're sitting, and then you can get infected that way. Could you clarify or, speak to that?
Yeah, and I think that's part of the reason that we really emphasize being outdoors. Outdoors is safer. Indoor, most of the big outbreaks we've seen have been in indoor settings. So indoor has the opportunity to concentrate the virus in the air. We know, most of the spread is through these larger particles that only move a few feet, but before they fall to the ground. But the smaller particles can be suspended in the air for longer periods of time, and in a crowded indoor space, they can concentrate. So there was an early report out of in Wuhan, China, I believe it was, where there was a well-documented case. It was a crowded restaurant, and there was like a fan blowing from one table across to a second table and across to a third table, and there was documented spread across those tables. Now that was sort of an extreme example, and that's part of the reason why we had the spacing, the 25% occupancy requirements when we were in the red tier before we closed indoor dining completely, to space people out. But there's a lot of things that can be done to make indoor settings safer. So putting in good filters in the system, so there's those high quality HEPA or close to HEPA level filters that can filter out those particles. Setting it up so you're bringing in a lot of fresh outdoor air into the system and not just moving around the indoor air. Opening up windows, and that's really important, again, for the holidays. If people are going to gather, they're required to gather outdoors in the purple tier counties. But if someone's not going to follow that advice on that requirement, and they are going to gather indoors, there's a few things they can do to at least minimize that risk. So open up all the windows, get the air circulating. It's stagnant air. That's probably the most worrisome. So open up, get the more fresh air in, get it circulating.
Thank you. Are there other questions for Dr. Go ahead, Mickey.
So during the summer, I think there was a study that said that gators are not good. But are there some kind of gators that you can just pull up and that are good? What I've done is I've like on a mask or on that a gator, I've held my hand outside of it, and if I blow through it and could feel it, that tells me it's hardly doing anything. Is that a valid way to evaluate the material?
Yeah, I mean, I think a lot of the concern with gators is a lot of gator material is very thin. So it's not the gator itself, but it's the quality of the material. You want something that's thick, multiple layers. Also, you want to have a good seal around the face, and sometimes a gator doesn't necessarily seal as well around the face as a snug mask might. So I've heard of, blowing it and feeling for the air. That's one way. Another is the kind of candle test. Try to see if you can blow out a candle through your mask. And if you can blow out a candle, it's not a very good mask.
And one other question. What do you know, a lot of us got home air purification devices during all the wildfires and everything. Would that help at all with the COVID?
I think the devices that filter the air, so if they're a HEPA filter or they're one of the higher level rated air filters that filter out a lot of those, small smoke particles that the PM 2.5s that we worry about with wildfire smoke. If they're filtering those out, then they're also usually pretty good at filtering out a lot of these respiratory particles. The devices that are like ozone producing, and there's some other sort of high-tech solutions. I don't think there's any evidence that those type of things really do anything to clean the air. It's really the filtering that's the key.
Thank you.
And there's one question from Chris Conrad in the chat. Are there special types of indoor air filters that are more effective than others? Activated charcoal versus fiber filters versus ionizers versus some other kind?
A lot of the filters are rated by this MERV rating. So a higher MERV rating is better. So like a MERV 13 or higher is pretty good. I think a HEPA filter is like a MERV 18 or 20 or something like that. That's one of the best levels, but those are a little expensive and hard to come by. So just trying to get one of those things that has a higher MERV, MERV rating.
Good to go. All right, Tom Lane.
Yeah, just one brief question. What are you doing to encourage compliance with respect to mask wearing and things like that in our local businesses? Has that changed since this upsurge began?
We have a whole compliance team that's working with our district attorney's office and working with local law enforcement and city code enforcers, our environmental health division, and when they go around doing their routine restaurant inspections, are also monitoring for compliance with the health orders around masking, around physical distancing. We have a complaint-driven response. So when a resident complains about a business that's not following the requirements, then we send somebody out to inspect and verify whether they're following the requirements or not.
And I'll add to that. I mean, under the health orders, each city is responsible also for enforcing the health order in the city. We've gotten varied, I guess the best way to put it, varied cooperation among the cities. Each city can designate a department, whether code enforcement, for example, police. And the approach up till now has been to really try to take an educational approach. Although we did pass an ordinance at the Board of Supervisors which sets some fines that could be utilized. I'm unaware of anybody being fined, but in the case of a store, let's say if you see a store that's letting people in without wearing a mask, I would report that store. We do have a general number to call our district attorney's office, but really each city should be really taking it on their own and they're not. Hold on, I'm just changing rooms here. Each city should be on their own doing something, but they really are not. And so I think this is something that we're continuing to work on, because frankly, the success of this does depend upon getting good compliance. I had one question on the KN95 mask, Dr. Farnatano, because a lot of folks who can't get the N95 are ordering these KN95. Can you tell us a bit about those masks?
They're similar. They're a slightly different standard. They're not approved for healthcare use, although they have been given sort of emergency approval for healthcare providers during a shortage if they're not able to get N95 masks. They're a fairly similar, so I'm not sure they're exactly equivalent, but they're pretty close to the level of protection that an N95 mask does. The key with both a KN95 and a N95 mask is ideally they need to be properly fitted. So there's a whole thing of formal fit testing to make sure there's no leaks around the mask, and different people's facial shapes fit to different brands and styles of mask, and facial hair prevents a good fit. So I had to shave off my beard in March because I wear an N95 in clinic, and I can't wear a beard with it. So a poorly fitting mask that's an N95 or KN95, where a lot of the breath is going around the mask rather than through the mask, might not be much better than sort of one of the cloth or the paper, surgical or medical masks.
Thanks.
And one final question, and then we're going to move on to our next presentation from Pam Morris. Please unmute yourself.
Just discussing what is it that gives people COVID? Is it, I mean, of course it's the breathing the air, of course it's the proximity, but is it, handling your mail? Is it eating food that's been served at let's say a curbside pickup? I mean, do we know any more about how you get it?
We do. Initially, we didn't really know how it was transmitted, and so there was a lot of emphasis on hand hygiene and hard surfaces. But we've learned a lot more, and that seems to be a very rare way that it's spread. Probably at really high touch surfaces where someone, touched a doorknob or a door handle just a few minutes ago could potentially be a risk. But the virus doesn't really survive on hard surfaces for very long. And so, people that are, not touching their mail for 3 days, it's probably excessive. We're really seeing it, it's being spread by being in close proximity to other people's breath. So it's being in the same room with somebody, they're breathing, and then you're breathing in those same air particles. So it's really spread through the breath. And we've seen, singing in choir in church really spread it. And we've seen, exercising in a gym where people are breathing heavily spread it. And we've seen it, over and over again in restaurants and bars where people are standing close together, and it's not the food they're sharing, it's the air that they're sharing together is what's spreading it. So, it's good to practice hand hygiene, especially when you're out and touching doorknobs and elevator buttons and things like that. But the virus probably only lives a few minutes on hard surfaces, at the most a couple of hours. And so, putting things, physical objects like your mail in quarantine for 2 or 3 days is really unnecessary.
Thank you very, very much. It's occurring to me that listening to you is so valuable, and you're so clear, it makes sense. And I feel like I'm much better prepared to understand what to do and what's unnecessary. It doesn't seem like we as a general public really have a clear understanding of what to do and what not to do. I mean, general, but not really clear. I wonder if the health department could talk to the news departments so that every night they're taking 3 minutes before the news to clarify some of these things. Not as a special report, but just the basic information like we've had here. I don't think we know what to do. Now we do, but
Yeah, no, I mean, you raise a good point. I think it's been an ongoing struggle to get right, to make sure there's good information. And the Bay Area health officers have all been working together to come out with one unified message that gets out to the community. A lot of the information that Dr. Farnatano talked about is on the county's website, on the health department website. And I know we've all tried to push it out. If you're on our email list, we send out pretty regularly and have for many months a lot of this information. So for anyone that's interested, you can sign up for our email and get on the list, and we regularly send out this type of information. But it isn't, it has to be pushed out through every channel: social media, email, news media, all of that.
Okay.
And
So
we are fighting a chorus of misinformation and disinformation that we have to fight against constantly. And unfortunately, we've got elected leaders in other states and at the national level who are pushing misinformation. So it's hard to create one clear, unified, fact-based message and get it out there in a consistent way.
Okay.
Tom, I would suggest, since the next item is the major fire presentation, Lieutenant Buford's been patiently waiting, and I suspect that his report is pretty short. And if it is, then I'm just wondering, I don't know how long Lieutenant Buford has, but the major discussion I know will be on fire, and I think the sheriff's report is usually pretty short.
I agree. I think we can go ahead and move to Lieutenant Buford's presentation.
Good evening, Supervisor, ESMAC Board, Lieutenant Buford, Base Station. Yes, and it will be pretty short. Actually, we guys had 715 calls for service in October, which is 106 less than the last month. You guys are actually pretty steady quote right now. It's nothing really grave concerns. I have not had any direct calls to me about any complaints in El Sobrante. Let me take that back. I did get a couple the other day relative to some bars that's on the damn road and COVID violations. Let me make this clear that we are looking at it. I know someone asked earlier, we are looking at the enforcement of the health order ordinance that's 2020-21 that has administrative fines attached to it for both commercial and non-commercial activities. And those fines are progressive based on the fact of, continued violations. So we are looking into that. And I'll have more discussion with my management tomorrow and then which direction we're gonna go. But other than that, I'll open up the floor to the board, to Supervisor first, and then to the board if there's any questions for me.
Any questions from the board?
From the public?
Okay. So I think we can thank
Tom, there's one question from Sohaila for Lieutenant Buford. Sohaila, go ahead.
Thank you. If I understand that in case of a wildfire or disaster, evacuation is done by the sheriff's office. Is that true? And have you considered evacuation routes? And would there be a drill for practice before the next fire season? Thank you.
Right now, I'm not personally aware if there's any planned drills that would come out of our EOC. Well, I'll tell you that so far as evacuations, when it's wildfires and things like that, it's driven by fire, and we are just one branch of that. So it'll be actually based on what the incident commander from fire would tell us as far as what they would like to have happen from the sheriff's office so far as evacuations, because it's a very dynamic thing. So I couldn't tell you that, hey, you're gonna go down this street and that's gonna always be the street you go down. I kind of think we revisited this
Yeah.
And it will be the same thing that, you know, it's very dynamic and it just changes all the time.
And that's the next agenda. Frankly, that's the next presentation. Let me make one thing really, really clear, because I've been through several of these. When there is a major emergency, there is an incident command center, an emergency operations center set up that has fire, police, sheriff, health, hazmat, whatever the incident is, they are all together. They are conferring with each other, and the incident command center then issues the order. Police, fire aren't off doing things on their own. We built a new EOC in Martinez, and it was actually staffed when the pandemic was established and then transferred over during the wildfire season. And when we had all those wildfire incidents, some fires here, they are working together in the center, conferring with each other, and make that decision out of that center based upon the information that's available to them.
And we have one question from Pam. Go right ahead.
Thank you. I actually just have two really quick ones. One is the 4th of July, maybe because people weren't going out into groups, there was unbelievable fireworks. I've never seen anything like that. It was all night, it was till 3 in the morning, and it was a lot. It wasn't just pop, pop, it was almost a show. And it feels to me like that's gonna be a new thing. And with all the wildfires in the surrounding areas, not our area, I live up on the top of the hill. I'm pretty concerned that we may not have the resources to put something out. Is that being addressed at all? And I do have a second question.
So far as resources to put out a fire, that would be a question that the next presentation would have to answer. I'm not really aware of what resources they have.
Okay, sorry if I asked the wrong question then.
No,
and
ma'am.
then and then the other question, maybe this is also the wrong question. When we had that preemptive evacuation a couple weeks ago, where the winds were very high, and we were told in the hills, El Sobrante Hills, we were told just get out, because if we get a fire, we can't come and save you. The winds are going to be too extreme. And of course that made sense. But then the winds never really happened. So I'm just kind of wondering about what's being done about accuracy, and then also what's done for that. If we have some kind of super wind event, what?
Can I say that's the next presentation?
Yeah.
And so,
Okay, sorry.
Yeah,
I didn't realize that.
Let's
I
hear from
thought
the
this
fire
was the
chief,
fire.
and then that would be a totally great question to ask after the presentation if it's not answered. Yeah.
So thank you very much, Lieutenant Buford. I think we can move to the next presentation, Chiefs Richard and Thomas.
Yes, sir. Thank you.
I believe Chief Bouchard is going to make the presentation tonight, and I'll be listening.
And Chief Bouchard, if you don't mind, before you start, Meredith Gerhardt, are you on the line, Meredith?
I'm here. Can you hear me?
Yes, ma'am. Okay, just wanted to make sure. I wasn't sure if you'd gotten in or not, but thank you.
I'm here.
All right. Please, Chief Bouchard. Thank you, sir.
Sure, no problem. Chief Thomas, good to see you. Meredith, good to hear you. I think there's probably a lot of different questions and concerns, rightfully so, about a lot of things related to fire. So, I mean, I think we could literally be here all night, but I wanted to at least do my level best to address some of the things that I've been apprised of from the El Sobrante area, and just give you a flavor of what's going on and what we've been doing with our partners, which includes law enforcement in the unincorporated area. Certainly that would be the sheriff. In certain areas where we cover cities, it's the city police departments, and then our partners at Sheriff OES, which is the group that Meredith Gerhardt is a part of. So I'll kind of go down to evacuation planning, and I'll start there. Lots of questions about evacuation planning and what are we as CON Fire doing? What have we done? And it's been said already, and I'll just reiterate that this is and must be a coordinated effort with law enforcement, fire, and our OES partners, which includes the CWS community warning system. I will tell you that last year, about this time, maybe it was in October, the county fire chiefs together submitted for a grant, and we were awarded that grant for $300,000 for evacuation planning and implementation software. This takes into account roadway topography issues and other information to formulate a plan that considers timing and other factors. And we're in the procurement phase of this this software system. It may end up being very similar to what other jurisdictions have already procured. Our goal is to really bring Contra Costa County together, regardless of which fire agency it is, whether it's El Cerrito or whether it's Moraga or San Ramon or Con Fire, under one common platform, so that evacuation planning, the language used for evacuation planning is consistent. Because oftentimes, one of the benefits that you have within Contra Costa County is oftentimes the responses and the folks that respond to fire incidents are without borders. So it doesn't matter if it's an El Cerrito chief officer that's responding into El Sobrante, into Con Fire's jurisdiction, or a Con Fire engine responding into Kensington. We all work very seamlessly, and we want a system that's going to support that. But really, evacuation planning, quite honestly, has to start and has to be the responsibility of each resident and their family. You really need to know your routes out. You also need to know secondary and tertiary routes out of your community. Have a plan, have a go kit with all your essential documents, at least copies of essential documents, things like passports and so forth, other irreplaceable documents that you really don't want to be spending a lot of time trying to figure out if there's an evacuation order that comes down. Once the evacuation order comes down, it's really a matter of minutes in which you should actually get out of the way. And that's not just to get you out of harm's way, that's the principal issue, but it's also to get you out of the way so that we can get in with the numerous pieces of equipment that need to get in, and sometimes very narrow and well-established neighborhoods. So we'll be building evacuation plans, but I want everybody to keep in mind that's on the phone call tonight that they're only plans. They're guides for all of us. The best analogy I can give you is not that I have ever played football, but I watch it, and the coaches on the sidelines have plans, and they're laminated. They're not drawn from scratch. They've got binders, and they're going to run a play, and they communicate that to the team. But as soon as the ball is hiked, that's the equivalent of the fire starting. It's not determined that plan is going to work anymore for a variety of reasons. The wind might be coming from a different direction. There may be a PSPS event that affects a school site that was predetermined as an evacuation site. Or a shelter, and any number of things can happen. So our plans guide us with fundamentals of in certain scenarios, or in a perfect scenario where everything was going our way, this is what we would do. I can tell you, based on numerous experiences, it never goes according to plan. The plan is used as a basis for the recipe, if you will, or a foundation for the recipe of how we're going to evacuate. But Lieutenant Buford is right. Whether it's me inside the EOC turning around to somebody at this community warning system and basically telling them this is the evacuation zone, this street, this street, this street, this street, and everything in between in that square, in that circle, is to be evacuated. Or an incident commander at the scene that is making an evacuation determination based on what's happening right there at that moment in time, and working with the law enforcement folks within a unified command structure to communicate that back up through the CWS system, which then goes out to you. Many times those evacuation orders are based on the conditions in the moment or where we think the fire is going and where the threat is going. It would be impossible to draw up plans for every possible scenario. So that's why it's so important for you to know how to get out of your community. And somebody brought it up earlier about the determination or the decision that we made to suggest that people that didn't feel comfortable should leave based on what we were told by weather forecasters, of which we are not, that there was tremendous winds coming. And I think that was the right decision, but most importantly, it reinforced the philosophy that you don't need to wait for an official evacuation to leave. If you don't feel comfortable, then you should leave and go to a family's house or go to a hotel somewhere that's outside of the fire area, particularly if you have access or functional needs, or you have yourself or family members that are going to take extra time or effort to help evacuate. Should that time actually come, you may not have all that much time. So think ahead and be prepared. And you don't necessarily have to wait for us or law enforcement to tell you what you likely already know, which is this doesn't look good, it doesn't feel comfortable, it's time for me to go. Make that determination on your own. Follow your gut instinct, and most importantly, know your way out. If you get out of the area early, that really helps us because it's less congestion, it's less people opposing us as we come in. So we are all about trying to get out as early as possible. There's been some questions about sirens and the use of sirens, and the short answer is no, we're not going to use community sirens to notify people to evacuate, because that's exactly the opposite of what they were designed to do within Contra Costa County. They're part of the community warning system. They're part of the shelter-in-place methodology within Contra Costa County. So sirens are contrary to notifying people to evacuate. And oftentimes we get questions about where's the nearest shelter, what facilities have you planned for a shelter. Really, that is not the primary issue that we're concerned about right away with evacuations. Our concern is to get you out, for you to leave the fire area, get to a safe area, get to a more urbanized area that is not within the fire zone, that is not under siege, if you will, or in front of the fire. And those, can sometimes be obvious. Sometimes they're very close by. Sometimes they're far away. But that's the first thing we want to do, is get you out. There is usually plenty of time to figure out which school site or where evacuees are going to be staged for the time being. And that's where staying in communication, being part of the CWS network and getting those CWS notifications is important. Listening to KCBS, KGO, the typical AM news radio stations. We'll be coordinating with them through our public information officers to give information about where people should go. But again, there's time for that. There's not a lot of time for you to get out and get to some place that's not affected by the fire. And as I said before, sometimes those pre-identified locations, oftentimes schools, look good in the plan and they make sense in the plan, and then there's a PSPS and they don't have power. And we can't put a bunch of people in a gymnasium or a school site that doesn't have power. And now we have COVID to reckon with. So we are working with our OES partners, and we're working with the Red Cross to work through the best method to provide a staging area that's outdoors, that's safe, that people can appropriately distance themselves, and then work with Red Cross for an appropriate evacuation center, which may be a hotel, and that may be the most appropriate as opposed to the more traditional evacuation site that we're used to, which is oftentimes a gymnasium. Talk a little bit about education and community drills. Once we get some of these plans together, I think it would be appropriate for us to work with you to coordinate some of the community drills. We've done some in Lafayette and Walnut Creek, and they're good. Obviously, not everybody is participating in them. Oftentimes, they're at odd hours on the weekend, and it's clearly not necessarily the type of heightened sensitivity or sense of urgency that you would have under a fire scenario. But it does help sort of get some of the mechanics going and getting used to which way you might go. We might work with law enforcement on doing what's called contraflow traffic, where we take all lanes and have them go in a certain direction, but that takes coordination, and it's good for us to train on that to see how that's going to work, and what issues might exist there. You know, with the COVID environment, we can certainly work on town halls, virtual town halls and education sessions as we get into 2021. There's certainly a lot of information on the web, on our website. 1 or 2 clicks gets you to all kinds of information about home hardening, defensible space, weed abatement, all sorts of information out there. And you know, a lot of the efforts about preparation come back to residents and homeowners. Defensible space, you don't need us to show up and give you a violation notice necessarily. There's plenty of information for folks to take advantage of and do the right thing and get prepared. One of the things that you're probably going to start to see next year is hopefully a ramp up in our defensible space enforcement program. It's been a long time coming. We are in the process of hiring 7 new fire inspectors. We hope to have them on board shortly after the first of the year. Some of those folks will be tasked with working in our community risk reduction unit that will have defensible space enforcement and education as part of their mission. And we're hoping to drive up compliance in certain areas, and the unincorporated areas of El Sobrante is certainly on that list. We're researching. Sometimes we get a lot of questions about, well, can we put an ordinance together to prohibit certain types of vegetation or plants? And the short answer is we are researching that. I'm very interested in coming up with something that will assist us in prohibiting certain types of vegetation from being planted moving forward. Things like juniper bushes, they're awful. If we could legislate their removal, that would be great, but that's probably not in the cards. But I think what we can do is work at prohibiting juniper bushes from being introduced moving forward. So we're working on looking what other fire districts have done and seeing how effective that could be within our own communities as we move forward. It's going to be a very lengthy process. It's not an overnight change. I liken it to after the Oakland Hills fire, and many agencies put ordinances together to prohibit the use of wood shake shingle roofs. It's taken 25 years, almost 30 years really, to get to the point where wood shake shingle roofs are really no longer common. And part of that was because you weren't allowed to replace your roof with a wood shake shingle roof. So something similar to that with regards to certain vegetation. Cypress trees is another one. You know, we're looking into that. Let's see. And then when it comes to red flag, let's talk a little bit about red flag days. We typically get somewhere around 18 to 24 red flag days, it seems, within Contra Costa County. Most of them are clustered in the September and October months, but there are a few that happen throughout the rest of the summer. Red flag days are not something that we control that determination. That comes from the National Weather Service. And oftentimes the red flag days, a Tuesday to a Wednesday, are not the same. The National Weather Service issues a red flag warning if there is the potential for fire spread based on the overall weather conditions. It's not necessarily that there's an absolute wind speed or temperature factor or humidity. It's really the grand combination of all those things. So frankly, some red flag days are very mild compared to other red flag days that are not. Typically, it's fueled by humidity and wind more than anything for red flag days. And we do our best to communicate out through our different social media platforms, including Nextdoor, of which the fire district has roughly 180,000 subscribers to our Nextdoor accounts, about when a red flag day is coming, and then when a red flag is issued. We also use Twitter and Facebook and all kinds of other things to educate people, and the local news media is informed. We do press releases. So there's quite a bit of information about a red flag event occurring. What you need to do in a red flag event is really to listen, be aware, have those preparations and plans ready to go. And in some cases, more than likely, as time goes on, particularly with these excessive wind events, or what we are informed will be an excessive wind event, we will be as proactive as possible to keep you informed and make notifications and suggest, like I said earlier, that perhaps you consider leaving early. The one comment that came up earlier about the fact that sometimes the wind doesn't necessarily manifest itself. My first reaction to that is, thank goodness it doesn't manifest itself. And sometimes the weather folks don't get it spot on, but other times they do. And other times they're not spot on and the wind is worse. So, weather is fickle. It's not easy to predict that, but we do our best to take the information that we have available to us, turn it into actionable intelligence, and then give you the best guidance possible on what you should do to protect yourself, your home, and your family as a result of what we think is coming. We certainly don't want to add any extra burden, but it would be remiss if we didn't suggest that you took certain actions and then bad things did happen. So other things about red flag days, we've worked with East Bay Regional Parks, and we've strongly encouraged them to close many of their parks on red flag days. And this year, thankfully, they did start to do that. I'm hoping that trend will continue. We do not want people in the open space areas, particularly in fire hazard severity zones during a red flag event. It's just not safe for them to be up there. It's also introduces more people into the environment, and frankly, that usually doesn't spell good things for us. So we'll continue working with them to keep those parks closed during red flag days, as much as that may not be popular. So I think for now, I'll just leave it there. There's obviously, I would think there's going to be more questions, but I'll just leave it there. And James, I'll turn it back to you. And I'm certainly here to answer any questions that anybody may have.
Thank you very much, Chief Burchard. I'm trying to, figure out what's the best next step. Sohaila also sent questions yesterday that Meredith Gerhardt was kind enough to respond to. Meredith, do you think you could kind of go over a couple of those? Any that aren't duplicates with what Chief Burchard just went through?
Sure. I think Chief Burchard just gave us a really nice summary. I think a lot of Sohaila's questions, a lot of your community questions have to do with vegetation management. It's exciting to hear that CON FIRE is going to be hiring some new inspectors who are going to be tasked with, in part at least, tasked with code enforcement. That's a big deal. Some of the questions about planning for an evacuation drill, I think Chief Burchard mentioned that the communities Lafayette, also Moraga, Orinda, and Walnut Creek, and most recently El Cerrito have done evacuation drills. The real value I've seen in these drills is demonstrating to the community and also bringing together the coordinating partners and having them just sort of practice and walk through the pieces of implementing an evacuation. And also, of course, every time there's a drill, there's publicity, and it drives up registration for the community warning system, which is a fantastic side effect. So absolutely, I think that's a great idea for your community. I think it would be a great way to bring together some disparate jurisdictions in your area that might have very real legitimate concerns about what type of coordination would actually happen during an event requiring an evacuation. So that's something we can all work together with in 2021. It is an undertaking, so everyone who's interested in participating, be ready to do some of the legwork with us. But it is worthwhile. I'm not sure if there were any remaining questions from Sohail or from the 94803 group.
So we'll go through, if you're through, we'll have some questions from our council members, and then we'll take questions from the public.
Sure, I'm through.
Copy that. Tom, do you want to?
Yes. So I guess one question that comes to mind is a lot of us live up on sort of winding roads in the hills, and we may have 3 or 4 different possible evacuation routes. And during the course of a wildfire event, any number of those may be shut due to flames. And is there any way of getting real-time information to a person in a particular sublocation in El Sobrante regarding which evacuation routes are open and which ones might be closed? I mean, I can understand how, you know, destinations like places you might go to shelter might remain relatively fixed over a period of time, but the evacuation routes themselves may be open or closed depending on wind conditions and things like that. So I was wondering what your thoughts were.
Sorry, go ahead, Chief Brochard.
Well, I was going to say the first thing is you mentioned roadways, and keep in mind many of the areas in the West Hills were built many years ago before much of this was considered, right? The codes were a lot different. So that's another reason to consider leaving well ahead of when you think you might get an official evacuation notice to give yourself extra time. So be proactive. We have had circumstances where when we are notified either through one of our law enforcement units or a fire unit that perhaps a tree is down over Elm Street or a power pole has come down, we can get that information back through to CWS to give out those text alerts, if you will, if you're part of CWS, to notify people that if you live on this particular street, you need to evacuate using this route. It takes us knowing that issue is there, and then it takes a little bit of time to transmit that through the variety of different systems that we have. And I don't know that happens very often for us, but it is an issue with regards to identifying, I'll say, problems with certain streets or evacuation routes, and then getting specifics back out to you. Meredith, I don't know if you have any more specifics on that.
No, I think that was great. I think one thing I might say is that the process of setting up an evacuation area with an incident commander between the incident commander and the community warning system will usually include verbiage around which direction to take and which way to leave the area. So for example, during the Morgan Territory fires this summer, the community warning system's message to community members included directions on which direction they should, included information about which direction they should travel down Marsh Creek Road and where they should be headed. So you can expect that information, even if there isn't a standard evacuation route in your community, even if we don't know ahead of time where you're going to go, some of that will be determined by the incident commander and communicated to you through the warning that you'll receive from CWS.
Can I underscore something Meredith and the chief said? And Meredith put the information in the chat. I think the single most important thing everyone can do so that they get informed in a timely way is to register your cell phone in the community warning system, because that is going to be the fastest, most direct notification to residents about what to do. And as you heard from Meredith, they would inform residents of an evacuation route, for example. So I can't stress how important it is to register your cell phone so you get those messages.
The other benefit Oh, excuse me. The other benefit of the community warning system is that if you're not sure if you're in an area that's been evacuated, if you haven't received an alert, but you see cars going in front of your house or whatever, you visit their website and you see if you're within the area that is evacuating. That's an official source of information. It's not gossip or hearsay or whatever. That's the area that the incident commander has said is evacuating. So even if you don't receive an alert, do feel free to visit their website and look at the area that is described as an evacuation zone.
Are there other questions from the council?
Yes, please.
Thank you, George.
So I live in the area of El Sobrante that's not affected by potential wildfires, but I do live on a dead-end street, and there's only two streets that connect to it to get out of the neighborhood if necessary. And this was necessary about a month ago. I don't know, was anybody else on the call had to evacuate the house because of the chemical fire on 80?
Oh.
Okay, so that was interesting. My question though is, on my street, in addition to the two streets that go up to Hilltop Drive, there is a fire road that goes down the hill, down to the streets below us, Ferris. Now, in the event that I have to evacuate and the two streets that I would normally use are inaccessible, am I allowed to use the fire road to get out?
So when you say fire road, I assume you mean an unimproved trail?
Yeah, I guess that's the way to describe it. It's an actual trail
Right.
that is next to a house. It's right at the intersection of Lambert Road and Santa Maria Road. And so it's like an easement, and it goes down the hill. And there is a gate, I think. I haven't looked at it in a while. And I'm wondering if I could, have the vehicle that could just run through the gate if needed be. Is that allowed?
Well, I think you're talking about a potential scenario that is of exigent circumstances. Under normal circumstances, yeah, I know. If you're trying to use a vehicle to get through the gate, the likelihood is that you're going to damage the vehicle. You'll end up blocking the road. That's an unimproved road that most vehicles can't pass anyway, the typical sedan or something. So generally speaking, fire roads are not good evacuation routes, particularly in a wildland fire, because you're probably going to be going into an area that has unburnt fuel, as opposed to staying on a paved road. So again, if you have limited egress options, that's where some forethought about maybe I need to plan to leave earlier, if you have that option, really does make sense.
Okay, the reason I ask is because I put something in the chat about a notification system other than CWS, which was presented to me because I did not know about the chemical fire, even though I live next door to Rolling Hills Memorial Park, and the fire itself was on the other side of the park by the freeway. So all of a sudden I get this notice, you have to evacuate. So it's like, okay, grab my stuff and go. And then less than 10 minutes later said, no, you don't have to evacuate. You can go back to your house. Yeah, that was a challenge because I decamped in Richmond, and it's normally 10 minutes from where I live to where I was. And getting back home, it took an hour and 15 minutes to go 4 miles. Now, you mentioned earlier in your presentation about traffic control implements, and there wasn't any by any agency. It was just like, it was like you were in a rush hour traffic jam on the side streets because you couldn't use 80 because of the chemical fire. So I guess I didn't understand why there wasn't more traffic control for that incident, because that was an actual incident. The threat of the wildfires is real, and I don't begrudge that. But this was an actual, real chemical fire incident that caused people to lose their, what, trying to get from point A to point B. So.
Certainly, and I wasn't engaged in that incident, so I can't necessarily speak firsthand. But what some of the things that you're bringing to light are some of the real world circumstances that affect evacuations. And in many cases, the plans, like I said before, aren't going to be as effective because of certain circumstances, whether it be weather, or topography, or the fire not cooperating, coming from the right direction. Not in every scenario will contraflow be used by law enforcement. And again, the most important thing to do is to get people out. Whenever there's something that bogs down a freeway like that, getting back in or getting anywhere is going to be a problem. But again, our first priority is to get you out. Whenever there's evacuations, we always try and take what we learned from them to find out if there were any issues that we could improve upon, whether it's the communication issue or whether it's the routing issue, or in certain cases like this one, perhaps there was some improvements that could have been made with regards to controlling intersections or other things like that to allow better flow of traffic.
Thank you.
Are there other questions from the council? Going once, going twice? Okay, so our first question we're going to get from Pam Morris. So Hala, because you submit the questions, I'd like Pam to go ahead first. Pam, please unmute yourself.
Okay, thank you. I just have two really quick questions. The first one is that saving lives is a very important priority, especially after the Paradise fires, of course. So job one, get people out safely. Job two, try to save the structures if possible. And now that we have these horrific wind events, it's probably going to be harder to do that. Fighting the fire will be harder. And now that we have these fireworks going off during the summer, which are on a scale that I've just never even imagined would be possible in a residential area. My question is, once the people part has been handled, what new procedures are going to be in place for saving the structures with the winds and then with the potential for all these extra fires with the fireworks?
Well, I think, Pam, I think you're kind of mixing some issues. I'm going to address the fireworks issue, and I would agree with you that this year was prolific, more so than any of us have ever seen. And I would say that rings true from Sacramento to San Diego. And as being one of the 14 metropolitan fire chiefs of the 14 largest fire agencies in the state of California, we have all decided that enough is enough. The system doesn't work. We're losing the battle on fireworks, whether it's safe and sane or whether it's these things that are going 100 feet in the air. This year was just prolific to the point that it depleted almost all the resources in Contra Costa County fighting fireworks related fires. So we're going to be working hopefully positively with legislators to try and do something about fireworks. Whether it was San Francisco or Antioch, it was just unprecedented. So that certainly does bring extra risk. With regards to change of strategy or tactics, we don't have a change of strategy and tactics necessarily with regards to fighting conflagrations or fires that are house to house or structure to structure ignition is what the term is called. The one thing that really needs to happen to reduce structure to structure ignition is defensible space and home hardening. And a reduction of all the clutter of material that is around homes that can burn, whether it's additional cars or RVs packed in, boats, all kinds of things. So that's part of defensible space, education and enforcement, but it's also part of each resident and each homeowner taking accountability for doing the things that they need to do to take care of their particular property. And then we can work with communities in groups of 5 or more homes to develop what are called Firewise communities, which take defensible space to the next level provide some potential funding where you and your neighbors actually get together and say, we collectively want to make a difference. We have decided that we are going to take care of our little part of the world here. And the more and more that we grow that type of initiative, the better off we're going to be. What we're dealing with trying to undo over 50 years of development decisions and vegetation management decisions. There's no way that we're going to be able to do that in 6 to 9 months. It's going to take years to try and turn that clock back.
Pam, you still there?
She muted.
Yes, I'm still here. I did have a second question if there's.
Go right ahead.
Okay. So I heard what you said about not using the siren system because it's a shelter-in-place system, and if you're trying to get people to evacuate, that's the opposite of shelter-in-place. So using a siren would be the wrong signal. But what I'm wondering is sometimes when we have these, let's say we have a huge earthquake and a fire. Let's say there is something big going on, and our cell phones aren't working. And we need to have some kind of a way of getting an emergency signal. I know the CWS system and alerts is very good, but if it's down, which it could be because we have these power outages, so it's possible it could be down. Is there any way that it could be considered that instead of having a long, kind of that kind of sound when we have every Wednesday, we could have a totally different sound that would happen from the sirens? It would be beep, 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 beep. It would not be confused as the shelter-in-place sound. Is there any possibility anybody would even be willing to consider that?
And I'm going to take a stab at that because I've been on the board now 22 years, and I was around when the system started. And it has been an ongoing education effort to really have the public understand what the siren means. And the sirens were designed originally as part of addressing chemical releases from refineries and chemical plants. And there was a lot of work done to look at how to have a simple message. Trying to change the type of siren to short and long is so complicated. It's complicated enough just having people shelter in place when they hear the siren. Go out in the middle of any industrial release when a siren is going off, and you will see plenty of people outdoors not knowing what to do. So all I can say is, and I'm sure Meredith and the chief will answer, but I can tell you, having been around from the beginning, we all have known it's an ongoing education effort all the time. And to complicate it with different types of sirens for different types of emergencies would just make it less effective. And now just keeping the simple message, you hear it, you lock your doors, you stay inside. So I'm not sure, here Meredith and the chief have to say, but I can tell you that I'm not sure that would be very successful.
I think I'd agree with you. I don't think the community warning system is going to accommodate a more complicated message or a message that says anything other than shelter in place for a siren. But I do think we've always encouraged people and continued encouraging people to keep a programmable NOAA weather radio at home that will alert you indoors or outdoors in the event that something significant kicks off, like an event like you're describing. So that's the workaround. That's the stopgap if you don't get an evacuation order or whatever it is through CWS.
And keep in mind, there's several systems that we will use. We will use reverse 911 to call your home phone if you have a home phone. Many folks now don't. They have just cell phones. We've all worked very diligently with state legislators to work on mandating emergency power backup for cellular towers, and we're getting there. So I think that there's been progress made at the state level to mandate that. It will take some time to get those in place, but that will make the cellular system more resilient. And I already talked about the reverse 911 to your home. Meredith mentioned the radio. We will be working with law enforcement if we need to send law enforcement through the neighborhood with a special high-low tone, with also the external public address speaker on their cars to be shouting the message from their cars. So there are other backups to a complete, and albeit unlikely, a system failure of CWS or the ability for you to receive CWS.
Okay. Pam, if you're good to go, we're going to go to our resident with the next question. Go ahead, Sohaila.
Thank you. Thank you, Chief Brochard, for an excellent presentation. You covered pretty much everything, and I would like to thank you for being proactive, asking for that $300,000 and buying the software right on time. Excellent. We're ahead of some other communities. And thank you very much for getting extra 7 fire inspectors. I totally agree with you that we as residents need to do our share, and believe me, we are trying to do. We have informative sessions through Zoom for the neighborhood, for the community members. We've had Meredith, we've had Cheryl from the Diablo Fire Safe Council, and we're doing our best. Actually, the next series are educating through our master gardener, Marilyn, who's here, about safer choices for planting vegetations. It's about the time now. And also how to amber-proof your house, covering vents with the mesh. We have all that coming up. Even thinking about the contractor who gives a discount and does a large portion of the community at the same time. But it doesn't mean that we shouldn't expect less from ourselves and from you. Please do not consider us nagging or complaining or criticizing. It's just that, wildfire is a reality, and we expect us to work together. We expect the authorities to work together. There's a petition going around for a joint powers authority. We strongly support it because we believe one authority by itself, even if you have the best plans, chances are you succeed better if you work with other authorities. Just to give you an example, red flags, we believe that we need actual physical red flags posted in the community, different places, to make people more conscious. Not everybody is on Facebook or Nextdoor. People speak different languages. But red flags, they can see, they can be more conscious, more aware of what they do, ban barbecue, things like that. We would like to have it along San Pablo Dam Road on major intersections. What the city says is not ours. We asked the county says, we don't have budget. We went to Diablo Fire Safe Council and they said, okay, we give it for free, but not to citizens. The entity has to ask us. So we asked the county, why don't you get it from them? And it goes on and on. We haven't had any results with simple red flags. We even asked, can we donate? The county said, no, we cannot get money from individuals. They can get from Diablo Fire. So bottom line is, we would like to be a closer team. We would like to make sure that different entities make a better team. For example, I asked the question, in case of a wildfire, I'm trying to get into freeway, does the person ahead of me going to observe the RAM meter, or the RAM meter is going to be off? In case of a fire, there is smoke, panic, confusion, traffic, accidents. You want easy access. Do you coordinate with Caltrans? We don't know. Are you coordinating with East Bay Regional Parks? On red flag days where there is a danger of fire, are there going to be bikers on Castro Ranch Road and impede the traffic and endanger their own lives? Simple little things. We would like to work with you. We don't want to be complaining or criticizing you. We just want to improve things, and we would like that chance and opportunity to work closer with you. We took it upon ourselves to work on community wildfire preparation plan, CWPP. And we don't think it should be Richmond CWPP. We don't think it should be county CWPP. we believe it should be 94803 CWPP because we are together. It's a community. I mean, you cannot separate the two from each other. And we expect your cooperation. We expect the City of Richmond cooperation. I'm glad that we do have that Wildcat Canyon gatherings together monthly, but we need a little more closer cooperation. Believe me, volunteers and committee members are doing a lot. We started educating ourselves, and we got in touch with similar citizen groups in Oakland, in Kensington, in El Cerrito, learning from them, best practices, following their footsteps. But we just learned our certain building codes, 7A or something like that. We had never heard of them. We changed our windows. Nobody told us we could pay a little more and have tempered glass in wildfire area. There's so many little things we don't know. We wonder if the county could be a little more proactive to reaching out, educating contractors, educating the people. That's it. That's all we're expecting. More communication, more teamwork. Thank you.
Certainly, and I appreciate that, Sohaila. I think that if I go back to 2007, 2008, when the fire district was considering putting in defensible space ordinances, there was just no way the public was going to accept that. I think one of the things that I've experienced in my 30 plus years in the fire service is that now there is an overwhelming amount of public support for different programs and education and enforcement and funding and being proactive, these partnerships between the various public entities and the community like I've never seen before. And part of that has to do with the unfortunate reality that fire is becoming a bigger threat for Northern California than it ever has been. That is an unfortunate motivator, but it is a motivator nonetheless. And I think that we need to take advantage of that opportunity and continue to work towards making the situation in 94803 or in Kensington or Lafayette or wherever it may be to be more fire safe. Because I think people's intentions on both sides, on the public side and on the public employee side, if you will, the public servant side, we all want to get there. And it's always a question of logistics and funding and people. But I think that working together is going to be the right solution. Simple things like the flags, I'm not really worried about the cost of the flags. If we can come up with a solution that's going to actually work, the cost of the flags is the least of my concern. But we want to have a plan that works. And if there's a CERT group or another group that can be organized to put flags out and do other sorts of communication issues that are relevant to a red flag, then I think we can get behind that and support that. So those are easy. There's going to be a lot of easy wins as we start to move forward. And then there's going to be a lot of long-term hard issues that are going to have to be dealt with. Massive fuel reduction projects are not easy to deal with. Short-term, small fuel reduction projects are easy. One thing I didn't mention is that we put a hand crew together this year of 14 people, and we just took them offline for the season. I'll be going to the board with the budget in February to double the size of that crew to make it a 7-day-a-week crew so that we can do more project work. It's not that they're going to create another North Orinda shaded fuel break, but what they will be able to do is clear vegetation around fire hydrants, clear vegetation around fire gates, fire road gates, work on some of the overgrowth that exists on some of the roads, and also work with communities on chipping, where multiple homeowners come together and we can rent a chipper and the crew can come out and do a lot of the work to be a force multiplier for a street or a court or something. So I think that many of the questions and concerns that you bring to light, many of those can get solved, but there has to be the willingness on both sides. I will say for my organization and the jurisdiction that I have control over, we will be in a much better position to support you once we get a few extra people on board, and that we have a good collaborative effort. There's many more of these meetings taking place now than I've ever seen before, whether it's the Wildcat Canyon group or this group. And so, again, I think the motivation is there, and the motivation is certainly there on our side. So I can commit to you that we have a high level of interest in getting to success. But the more proactive that we can all be on both sides, then the more successful that we're going to be. When it comes to things like I think you're talking about the HOV lights or whatever you call them on the freeway. Is that what you're talking about, getting on the freeway?
Yes, RAM metering entrance.
Yeah.
From the street you want to get into.
Yeah, so depending on the circumstance, California Highway Patrol would be with us at the incident command post, and they can affect that change. So if they're at the command post with us and we make that request, that's how it would get done.
I perfectly understand. However, if the more drills we have, the easier these protocols are. That's why we're asking for a drill before the next fire season starts. You know, simple little things that we can do together to educate the public. For example, if there's a fire in Tilden Park, Wildcat Canyon, people shouldn't go on Camino Pablo Road. Is it going to be closed? We can educate people ahead of time. In case of a wildfire, don't take that road. Maintaining other roads, and also doing CWPP together, educating the public about it. We're doing our best to try to educate the community, but we need to be in touch with you. Do little things that you suggested, like red flags. We want to make sure that the city of Richmond and county can work together, and also city of San Pablo is a part of it too.
Certainly. And with regards to the CWPP, I took that to the board in May. And the board adopted it in May. And some of the principles of the CWPP that would affect 94803 are some of the very same things we're talking about: evacuation planning, defensible space, home hardening. Those are the principles of the 5-year CWPP that is with us from now until roughly 2024 when it gets revised again.
So I would like to see if there are some other individuals who have questions for Chief Brochard. Ms. Sarney?
So actually what the question might be is who should we talk to about this? And that is, we've been talking about evacuation routes, and my biggest concern is identifying secondary. I wasn't even thinking of tertiary, just the secondary routes, so that we can ask the powers that be mitigate the probable failures of these routes. I mean, anyone who drives around in certain portions of El Sobrante will know that there are cliffs off one side of these evacuation routes. They have trees that are falling over. There are people who park on the side of the road. They just striped Sobrante Avenue, and that was actually huge improvement, because if someone were traveling on that road in smoke or nighttime poor conditions, you can actually see the center of the road now. And I think this is the piece that we are missing about identifying evacuation routes. It's to have these evacuation routes be maintained for safety so that they're passable come evacuation time. And also, you know, in Oakland, they identify roads and tell people they can't park on the side of the road. So is there any thought to this piece of it? Because it never comes through that there's any consideration of this particular problem. And if we're getting FEMA funds, this seems to me a good place to start with FEMA funds, is striping these roads and getting rid of vegetation that could fall on the road.
I think part of it is, you know, identifying where the issues are. And when we get into the evacuation planning part, it will help us because we'll be able to put in factors as far as roadway width and topography and other things like that. But that's not going to replace the boots on the ground assessment of some of the other deficiencies that might exist, whether it be parking congestion or whether it be trees. Trees are, I'll just tell you, trees are not an easy thing to deal with. It's probably just best to leave it at that for the purposes of this discussion.
I'm a master gardener, so I actually know exactly.
Yeah, yeah. There's a lot of politics and issues around trees. So not that they can't be limbed up, not that they can't be maintained, but whose responsibility is it? And anyway, they can go on for a long time. Certain communities have been successful in various parking restrictions during times of the year, and times of the year is probably the most important versus a red flag day because that's just too ad hoc. But during certain months, you can't park here. I'm very interested in pursuing those types of things. Again, the fire service is kind of famous for find somebody who's already done it, rip off their work, and put your name on it if it works. And so we'll be looking at that over the winter to find out who has ordinances and look at their success stories to see what we might be able to do. So there's a lot of elements here. We have just put together our community risk reduction team. We haven't had the staffing to be able to do that. This was the first year that we did it. All of what you're talking about is part of what we call community risk reduction, or CR squared. And some of those inspectors are going to be going towards that effort. So we're going to have to take it in chunks. It's not going to happen overnight. But a lot of what you're saying is part of what we have been talking about behind the scenes at Con Fire that has not been taking place for years. And as I said before, the time is now. Climate change is something that's affecting Northern California. The fires that we're seeing here are not just Southern California events. We're seeing major fires here that weren't here 10 years ago. So I think there's certainly motivation on our side, but I don't want to create a false sense that by June we're all going to have this figured out, because it's going to take a long time to keep taking small bites.
Can I raise?
So thank you. We have a question.
Tom.
Yeah, question from Pam Morris.
Well, we had a question from Melinda first.
Okay.
Oh, thanks, John. I just, in the chat, I've been trying to nail down something that maybe the chief can help me, or maybe some of the other fire people can. I did CERT training in San Francisco and was connected to my local firehouse there, and that was very well organized, and it was a very valuable thing. And CERT, in my mind, is a really great way for people to genuinely be part of the whole. I love being part of the fire family in San Francisco. The problem is, for those of us in El Sobrante, there's a CERT thing in San Pablo, there's CERT in Richmond, there's CERT in Pinole. What's the best one for us to be engaged with, or is there a county CERT that would connect us, for example, to Engine 69, which is our local firehouse for most of us? And so I'm curious, which would be the best CERT for us to take so that we could genuinely be engaged?
Certainly, I would have to do a little research on that, Melinda. When CERT first came around, the fire district was part of birthing and training the original CERT teams. But then once they were up and going, they became part of the city system. The fire district doesn't have a CERT team or any CERT teams. They're all attached to a city. What I don't know is whether or not the sheriff's department has a CERT team. I'll have to look into that. But again, this is another one of those elements that if we have the motivation and we have the will, it's certainly within our capacity to make these things happen where they don't exist, particularly if it's in a particular community, an unincorporated community that isn't part of a city CERT team. So I'll have to do a little research on that.
That's helpful to know. In San Francisco, it wasn't even called CERT. It was called NERT because they invented it in San Francisco, and it was very much attached to fire stations. But yeah, I think locally it would be, and the training is invaluable because through a CERT training, not only can you learn how to be of assistance to law enforcement or fire, but you really do learn things that will help you to do a better job of your own evacuation and caring for yourself. I think about that training all the time, and I thought about it a lot during fire season. So I think that would be a great positive thing for us to look into, and maybe that's something we need to talk to other people, and maybe John actually has an answer.
So John, I think this might be a good point for you to jump in.
Well, yeah, generally, let me first say it
And
is
right after John is Pam Moore. She had her hand up.
Yeah.
great to see all the really community interest. And Sohaila, you and others are doing a lot of really good work, and it's really important, and community is a really important part of this. I wanted to say that a lot of things that sound easy turn out not always to be. And for example, let me just address the parking issue. There's been an effort. I mean, it makes sense to think about where do you have parking on one side of the street during a red flag day or during a fire season. This exact issue is causing community division in Kensington, where our office has been working on an effort in Kensington where they have their own fire, which is part of El Cerrito Fire, and there's been an effort to look at having no parking or even having cars face a certain direction on a street on some small streets up in the hills in Kensington near the entrance to Tilden. And there's a police district there as well that would have to enforce it. And the county public works, county board of supervisors would have to issue the appropriate resolution to change the parking. And there was discussion about making sure there was a community process. So the Kensington Police Department has been holding meetings throughout certain streets in Kensington, and you can't believe the community division over that issue. So it may sound easy to say, just get rid of parking on one side or do this, but when you engage every resident on the street, you're going to get different viewpoints of what they want to do. I've told the Kensington Police Board and Fire Board, once you've gone through this process and you pass your resolutions asking the county to change the parking or street flow, we will do that. They have been unable to reach consensus over several months. So I think when we engage community, we will hear different points of view. Saying not to have bikes on Castro Ranch Road, you will hear an outcry from the bicycle community. There are people who don't have cars and their only way to evacuate is a bike. So it's a lot more complicated, but these are all things that deserve to be looked at. Doesn't mean we can't go through a process. I'm hopeful Kensington will reach some consensus so we can change some of the parking rules. Maybe it's easier to do that in parts of El Sobrante. I can tell you it's been a real challenge in Kensington, and they haven't reached a conclusion. So I'm sorry, Melinda, your last question?
Yeah, I was just, because of my experience with NERT in San Francisco and CERT in other places, one of the weird things about being in an unincorporated, which I've learned tonight for sure, is that, being part of San Pablo, CERT doesn't make sense. Being part of Pinole doesn't really make sense. Being part of Richmond doesn't make sense. How would we, for example, get connected either to the Sheriff's Department or, frankly, Engine 69, which is our local firehouse? And that might be a very meaningful way to be connected.
Yeah, I mean, I think, right. I mean, there's, unincorporated area doesn't mean there's no services. We offer the same services as a city, as you hear from fire and sheriff. And I think that
there is no CERT group, John.
Right. There is.
We've all been looking.
Right. There's an issue. I think that's a good issue that we can take up with fire or sheriff. Typically, I think as I understand it, they're generally run through police or fire. And so in the case of the county, it would be fire and sheriff's department. And we can take that issue up to see if we can get agencies to work together to support a CERT team. I think that's a good one. And I think, Sohaila made a point, which I think is really important, about 94803. The valley is split between the city and the unincorporated area, but it's all the same issue. The fire issues are all the same. And it is important getting the fire chiefs work together, getting the residents to working together. And they realize that the lines don't mean anything, and all this planning has to be valley wide, right? But we can follow up. I mean, look, Chief, Burchard, I mean, can have discussions with fire and police about, is there an ability for us to look at how we set up a CERT program in the county?
Okay. Thank you, John. I think we can take maybe a couple of more questions, and then we really need to start wrapping things up.
Pam Morris had her hand up for the longest. Pam, if you were still on.
Okay, Pam, go ahead.
Thank you so much for recognizing me. I took my hand down, and I just want to thank everybody for contributing so much. This has been a great, great meeting. And thank you, James.
Okay,
You're welcome. And so, Hala, with the last question for this item.
Yeah, thank you, everyone. Chief Burchard, if I may ask you how we can be in touch with your office to resolve this red flag issue and hopefully have them soon.
I can give you the fire marshal's information.
Sorry.
Yeah, I can get it to James to get to you.
Okay, thank you very much. I appreciate it.
Thank you, Chief.
And many thanks again for your hard work. We really appreciate what you do.
Oh, you're welcome.
So, thank you, Chief Burchard. It was a very informative presentation and question and answer session. And thank you for being here as well, Chief Thomas.
And Meredith hopped off, but I definitely want to thank her for coming on as well.
Okay.
Yeah, you're welcome. Thank you.
So that concludes our presentations. We do not appear to have any discussion items regarding building modification requests, appeals, variance reports, etc. We do have a public comment agenda open now, and so these are for 2-minute comments that are not on subjects that are not on the agenda. So if anybody would like to talk about something for 2 brief minutes, that would be fine. Do we have any takers for open agenda?
None that I see.
Okay, so in that case, are there any information reports by MAC members? Okay, we do have 1 alternate seat vacancy on the ESMAC, and we welcome participants who wish to join our council. As you can see, it's extremely interesting.
We are interviewing now, just so you know. We got some good candidates.
Oh, wonderful. When do you think we might have a, the next person?
I think in December.
Awesome. That's good news. So in that case,
Vicky?
we
Yeah.
do have, go ahead, Mickey.
If I just have one thing to say about the illegal dumping subcommittee, which is that it has been inactive. We haven't been able to get a meeting going yet, and I assume that maybe we'll have one next year, considering we're coming upon the holiday season and everything. But I just wanted to say that on Nextdoor, there has been a group that is forming right now called the Nextdoor, I guess, Neighbors Cleanup or something like that. So I'm going to start networking with some of those people, and maybe we can combine our efforts somehow or another and actually do something, possibly get together and adopt a road group that we can get the resources from the county to increase our efforts. But anyway, that just happened last night, that this other group was formed on Nextdoor. So I was happy to see that, and that people are still interested in pursuing this issue and keeping El Sobrante clean. That's it.
Okay, maybe that might be a good agenda item for our next meeting.
Copy that.
Okay, and I think we had a really productive conversation about fire, and we might sort of brainstorm and think of a way of keeping the momentum going, because we have good engagement on something that can really benefit the community. So in that case, I think we've reached our time for adjournment, so I'd like to motion to adjourn. and thank James for hosting an excellent meeting, and John, Joya, and our other guests for coming and speaking with us. This has been really valuable, and I'd like to thank everybody who attended.
Thank you. Thank you,
Thanks,
everybody.
Tom.
Thank you, everybody.
Have a good night, everyone.
Good night, everyone.
Bye-bye.